I've worked with a lot of physicians who were from foreign medical schools, if you will. You have to give them a chance and see how well they can do, and to me, coming from foreign medical schools is not a major issue. I've also taught it some. I've learned a lot over the years, and I think it has to really be looking at, I don't think you can make a generalization about non-U.S. schools. We know that there's a doctor shortage, and we know that many times hospitals will select or match with students from foreign medical schools because they need the doctors and they're not getting other students, or they have the options, but for some reason they select. It's not always because I can't get somebody else. They select the students who are maybe from other schools. And I hear from both sides. Dr. Owen is very proud, and I've looked at the list of matches, and he's very proud of how well the students at Ross did in their match and where they'll be going for residency positions. And while I heard from Dr. Owen how proud he was with how well his students did in the match and the many wonderful hospitals they matched in, I'm hearing from those in U.S. schools how concerned they are because there are fewer positions for residency programs than there are graduates, and how many students are not matching from U.S. medical schools, and they sort of see it as competing with some of the offshore schools. Obviously, the answer's got to be to increase the number of postgraduate positions. I think that's going to have to happen. You can't just say, well, too bad, and these kids can't match or can't do a residency, because there is a doctor shortage, and especially in primary care field. So we can't just put our heads in the sand. I think as long as you've got leaders like you have for Dr. Owen, who are making sure you've got rigorous academic standards and your students are doing well, not just testing well, but doing well in their clinical services, that there's no reason those students shouldn't have opportunities for any place they wish to be. And we still have to deal with the concerns about students who really feel that the minority students in the U.S. are the ones who are not getting matches. I don't know if that's really been documented. I know that there are several groups trying to get the data to really study it, and they haven't yet, but that's sort of the impression people get. I hope it's not seen as a competition. I think the pool of medical school graduates needs to be strengthened wherever it is, and obviously we need more doctors because we've got more health problems. One of the comments which is interesting is that the U.S. is one of the few countries where there's been a slow decline in life expectancy, and we're such an we're outstanding in science and medicine, we think, and yet our patients or our population, we're not seeing expansion or extension of years of life. I've been in so many meetings and discussions just within the past month or so on the issue of maternal mortality. In the U.S., has had a steady rise in maternal mortality, and it's the only developed country where there has been a rise, and it's really striking. And why is that the case? Why, when we know and we've talked about it, maternal mortality has been a topic for years, why are we still seeing a rise in maternal mortality? And no factors have really been identified, but it's getting to be a crisis and it's being picked up. And how we're going to address that, we really need healthcare providers who are going to have the time, take the time to both do the research and to really deal with women in the maternal mortality issues or any of these other health issues. And we can't do it just by discriminating on where you are, but we need to have more well-trained doctors, regardless of where they come from, who are dedicated to the practice of medicine and improving the plight of life.